So this is atopic eczema, burden of disease and individual suffering, results from a large EU study in adults. So basically, atopic eczema is one of the most common non-contagious skin diseases worldwide. It is a very ancient disease found far back in ancient medical literature. And after it was first described in dermatology in the 19th century, it became more prevalent in the late 20th century. So 10 to 20% of children in the world are suffering from eczema, and it was mainly before thought of as a pediatric disease. And now it is seen that more adults are becoming more affected with the disease, and there is an estimate of 3 to 5% of the population, the general population, having it. So there are three things that affect the disease: the epithelial barrier dysfunction. So basically, there's something wrong in the barrier of the skin that causes a lot of water to come out of it, right? There is also a deviated immune response, which causes allergic reactions from basically the environment to foods that the person eats. And then there's also the psychoneurogenic inflammation that causes itching. So basically, the nerves cause a lot of itching in the skin, and then it inflames. So it is also an economic burden on the patient and family. And one study on the quality of life of children with atopic eczema showed that their scores on their impaired quality of life were similar to those with cystic fibrosis, cerebral palsy, and other diseases. So basically, there's a shortage in quality of life of there's a shortage in quality, not quality of life, but quality of healthcare for these patients too, and the actual degree of suffering of these patients has not received enough attention in the scientific community, basically. So this study was to assess the individual suffering and the burden of having eczema. So this was a cross-sectional study with over 1,000 adult patients suffering from atopic eczema between 20 to 87 years old. It was done on a telephone interview. It was about 20 to 30 minutes long, and so basically they asked them questions from a questionnaire on the phone, right? They used the term dermatology life quality index, the hospital anxiety and depression scale, they also used the patient-oriented eczema measure, the self-assessment of severity, and atopic eczema score of emotional consequences. So 55% of the patients reported to suffer from moderate to extremely large effects of atopic eczema on their health-related quality of life. So these patients reported itching, pain, and stinging, this was reported in 3 out of 4 patients. More than half of them reported feeling embarrassed about their skin within the last 7 days, and it influenced their choice of clothing and what social situations they were going to participate in, all things like that. So it was shown that their burden increased with the severity of their disease. So there was an extreme loss of quality of life was only 1% in patients with clear or nearly clear eczema, but it was 67% in people with severe eczema. Depression also correlated with higher severity too. And so they were they asked them different questions, and this is what they said. So 75% wish they had normal skin. 57% said the itch just drives them crazy. 50% said that eczema makes them sad. And 51% said that they tried to hide their eczema from the world. About 75% reported problems with intimacy because of their eczema. So basically, these people are suffering to an extent that really isn't acceptable in today's standards. So it should be taken serious, because many physicians and health officials the general society really don't take it seriously. And the fact that eczema is so prevalent really shows that they should, So yeah.